How do male and female urethras affect bladder function? Imagine the journey of urine from your bladder to the outside world. The path it takes is different for men and women, and these differences influence how our bladder works and how healthy it stays. The male urethra is quite long, about 15 to 22 centimeters, passing through the prostate gland, pelvic floor muscles, and the penis. It has a dual role, carrying both urine and semen. Because of its length and complex route, the male bladder needs to generate stronger contractions to push urine out, and the internal sphincter muscle is well developed to help control flow and prevent backflow during ejaculation. In contrast, the female urethra is much shorter, only about 3 to 5 centimeters, and runs straight from the bladder neck to an opening near the vulva, embedded in the front wall of the vagina. This shorter length means that women requiring less pressure to empty their bladder. However, it also makes the female urinary system more vulnerable to infections because bacteria have a shorter distance to travel to reach the bladder, which is why urinary tract infections are more common in women. The anatomy also affects continence. In men, the internal sphincter muscle is strong and helps keep urine in when not urinating. Women relying more on the external sphincter and pelvic floor muscles to maintain continence. Because the female urethra is close to the vagina and more mobile, it can be affected by childbirth or pelvic injuries, leading to issues like stress urinary incontinence, where small amounts of urine leak during activities like coughing or lifting. Bladder health and disease presentation are also influenced by these differences. For example, bladder or urethral cancers may spread differently in men and women because of the length and structure of the urethra. Surgical procedures for bladder issues take these anatomical differences into account to improve outcomes and preserve continence. In summary, the longer male urethra and its dual role mean men need stronger bladder contractions and have a more complex sphincter system. The shorter female urethra makes voiding easier but increases the risk of infections and stress-related urinary problems. Understanding these differences helps healthcare providers better diagnose, treat, and manage bladder health issues for both men and women. Always consult a healthcare professional for personalized advice and care tailored to individual needs.